go even more efficient. Okay, so I made up lab worksheet 2. I know we still gotta finish lab worksheet 1, but, so I'm gonna try to interject some different things, and you guys will be kind of my guinea pig, because I kind of like the idea of this flipped classroom. It puts you to read some, which we already do for the study guides, but then I think we might use some of our time better here. And then you can really get better. Something you don't understand, we can spend more time on instead of stuff that, oh, I already get that. Why are we spending so much time on something we already all get? Okay? So that's your first thing. You want to, so Tiana, if you want to show me your 2 study guides and label it. So I'm going to put I'll get my blank ones out and around the groups, and we're going over study guide 1, and that way, and make sure everybody takes a turn answering of your group. It's not the same person, it's a team, so no one gets to go again until the other person has gone. And then some of you will have to come up with a diagram, your whole group will come up and make sure the diagram's correct. Okay? Question number 1 for group 1. What are 3 types of patient collections? And kind of as we go through them, we'll discuss a little bit too. So it'll kind of be, you know, if we were lecturing, but as a group.
Alright, so 24-hour clean catch, first morning, time, voided.
So what were the 3 on the PowerPoint? No, it's only group 1. No one answers from another group until I get to your group. So what was on your PowerPoint as 3 types right away?
No, did you have patient supervised and assistant? Yeah, I did. Random first morning.
This is patient collections. What are patient collections, not patient specimens?
Supervised, assisted.
Okay.
Random,
I'm gonna change that question to include both. Okay. Tell me what is in a patient collection. An example.
First morning and time.
Okay, so what would be, I gotta clarify that, what I want you to know.
Is that question on the study guide?
It is.
What's the first question? Mine says what's the types of
Yeah.
specimen collections.
The 3 types.
Yeah.
No, she just made one.
No, the question she's asking is.
I want to clarify what I want for you to study. How could I word that better? And I'll change it before I give you put the key up. If I wanted random, first morning, and timed. How would you want me to word that better for you to understand on the test?
Specimens, well, it says specimens
What are-
collected by cooperative patients after instruction. So,
What are 3 common,
instructed with,
Patient collections.
instructed collections.
instructed, because you wouldn't do a catheter as an instructed, you wouldn't do suprapubic as a, okay, so.
Some sort of instruction for a catheter.
So then we'll have to add one. Okay, so I'm gonna change the question to, what are 3 common patient instructed?
Patient collected,
Urine specimens?
instructed, like, because it's collected
Or
by the patient.
by the patient. Patient collected specimens?
Yeah.
How about that? Would that get you to know random first morning time? I'm gonna change that first question to that, okay? So, explain
This is
to me, because we're
She
gonna
wants
have
these.
further down about some of the other ones.
Yeah, I got
So, tell me about a random.
Doesn't have to be a specific time, so it's easy for the patient.
Used for routine screening.
Okay, so tell me, Amanda, why would you encourage first morning?
It's the most concentrated.
Okay, And then tell me an example of when you might do a time. You don't have to tell me about the time, just give me an example of when you would have a time collection. A time, that the time matters. If it's a timed collection,
Time of the day, so not a 24-hour.
well, that's an example of a good one. Probably the most common one you're gonna run into is a 24-hour collection. There's one called a 2-hour PC or a 2-hour postprandial. That's always in relation to glucose. It would be they do a blood test at 2 hours and they do a urine at 2 hours after they've had a set meal of carbohydrates and see if there's any spillage of glucose. I don't think any of you are gonna see that. Another time there was a timed one. Was anybody here have anybody who's had a diabetic in their family? There's a glucose tolerance test that now is only done with blood. Back in the day, that patient not only got their blood drawn, but they also gave a urine specimen every time. Okay? So, random, if I'm gonna do a random urine, because the doctor doesn't care, just bring it in for a doctor's appointment and they don't care, you still would encourage first morning, because that's gonna be when things are gonna be in their most concentration. A lot of times we back in the department don't get to tell patients the right way to do things, so you hope and pray the staffing that gives them instructions is telling them that. Okay, so I'll reword that on the study guide before I put the key up. So, the next question is, we kind of covered random and time. On the time, group 2, I want you to explain to me what would be important characteristics of a 24-hour urine so that it was done correctly.
To discard the first time you empty your bladder is when the time starts, but you discard that urine.
Okay?
You wanna do it?
Anything else, Katie?
Do you wanna do it every 2 hours or after a meal? Oh, yeah, every 2 hours after a meal.
No, this is the 24-hour urine collection. So we know you gotta discard the first one. If I'm starting it at 10 a.m., why doesn't that go in the urine? Why doesn't it go in the container? It was formed before 10 a.m.
Yeah.
You want all that gone. You're going from 10 a.m. today to 10 a.m. tomorrow. Okay? So what would be a second thing you tell them?
Collect everything.
Everything
Yeah.
in the container.
Container.
What would you tell them, Katie, at 10 a.m. the next day, at 24 hours? You think you'd try to collect it or not worry about it even if they didn't have to go? If you want all of the urine made in that 24-hour period, what do you think they should do at 10 a.m. at the
They
end?
should go ahead and collect it then?
Yes,
Okay.
because then you've gotten everything formed, and those are key instructions. So make sure, in this, you may be the one giving them the jar. Back when I worked at St. E's, they'd say, hey, we have a 24-hour collection, a patient's here to pick up their jar. You need to bring it up? Then we would be the one to tell them. That's 2 key things they need to know. Go at 10 the first day, then collect at 10 the second day. Then what at least minimally should you do to that container?
Refrigerate it.
Refrigerate it. In chemistry, you should have a card or something that tells you if they want for protein and creatinine, which we're going to get to those in both classes, it doesn't need a preservative. But there might be some 24-hour urine analytes that you have to look up in a card. Oh, this one needs a tablet. Oh, you want to get the door? A tablet of boric acid put in it. You've got to read one instruction, and Leah, you're over here with group 4 with Patricia and Tiana. You've got to read the instructions for every analyte they may order. Don't just think, oh, everyone's just refrigerated. It's not. You don't have to memorize them. We had a little card that said, okay, for calcium, add boric acid, for this, add this. Remember, you want the patient results to be accurate, then you gotta give accurate instructions. And that's some of the problems with urine, not accurate instructions are given. Okay. Group 3. Tell me what would be examples of supervised collection. Okay. Chris, tell me what you would tell a patient for a midstream.
Midstream?
Mm-hmm. You're instructing them.
Actually, trying to first you would have them start,
Mm-hmm.
then throw the cup underneath the midstream, and
Okay.
fills the appropriate line, then discard the whatever is remaining.
Well, sometimes you can only collect
Yeah.
what, how big the jar is, but we can do as little as a mil, a urinalysis. So you don't have, if they tell you, oh no, I can't go, just go anything. Because pediatric ones in this little U bag, you may get this much of urine. You can still test it. Okay, so why do you think a midstream would be preferred?
Because after you start going, you kind of clean all the bacteria out first. So
Off the skin. If you're assessing bacteria, does anybody remember from class yesterday which two analytes pads went with UTI? One was for gram positives and one would be positive for gram negatives. Nitrites and leukocytes, okay? So if you're assessing maybe presence of bacteria in that urine, don't you want to have a chance that the urine that doesn't have bacteria from the skin? That it really came from the bladder or the kidney? Yes.
And you said there is, if they have a UTI, that it can cause bleeding as well, that we.
Possibly. People who have a UTI might have some blood in their urine.
Okay.
So the midstream and first morning, does everybody realize why that should be in every urine collection that you're going to do a urinalysis?
Mhm.
First morning is going to be most concentrated, so if they have something, there's a chance it'll be there. And then your midstream, let's not add any more bacteria than we have to. So is it perfect? No. And on a random urine, we're going to have some trace bacteria. That doesn't mean it's anything bad for you, especially in women. Guys, it's a little bit less exposure to skin than a woman is with their anatomy. So, next one. Tell me okay, group 4. Tell me you're going to give instructions for a clean catch. And I'm going to relate a question back to the random urine after we get through with you. So, Tiana, you tell me what would be one of the key things a patient you would instruct before they even void it into the container?
You wanna make sure that they use one of the mechanical cleaning wipes that they use.
And this is why it's assisted. How many times, maybe an elderly may not understand the instructions, or you got a little kid that needs a clean catch. And it's not always, and even the book says all the technical terms. Basically use both towelettes, if there's two, and clean in the same direction. And on a woman, try to be detailed when you clean. A guy's a little easier to clean, but use both of them that are provided to clean the whole area before you do a first morning if possible. If they just come into the lab, it won't be a first morning, but at least midstream. But the cleaning is critical. When I tell the students, when we start doing the urine under the microscope and any of you look like you have white cells or bacteria, I'll give you one of our sterile containers and just say, after you clean really well, when you take your shower, void into the sterile cup. So if you know they're coming from home, at least have them clean very well in their shower, okay? Patricia, then tell me, what would be a critical piece of a clean catch versus a routine random urine? What would be a key piece? We already have one, the cleaning. What do you think the patient would have to use in the clean catch versus what they could use in a random UA.
If they have to use the midstream.
Well, midstream would be that, and that would be good for any good collection. But think about what they're catching it in,
Oh, it has to be a sterile container.
sterile. So Leo, what does it have to be then reverting back to theirs? What kind of container can it be if,
routine meal, or
Yes.
just a clean container?
just a clean one? So one of the things we'll come across the dipstick, and there'll be things that cause false negatives and false positives. One of them is detergents that might be present in the container can cause a false positive. You can use a clean container for a routine UA. It does not have to be sterile, but it needs, if you're bringing, let's say, a little jar from home, and you're gonna bring it into the physician's office when you come for your appointment, you should do first morning, midstream, put it in a baggie, put it in the refrigerator, but it should be a clean container free of detergents. It does not have to be sterile. So that was the key thing. A clean catch has to be sterile and they have to clean beforehand. Or really, it's kind of like doing a rapid strep. I think Diane's gonna do the throat swab with you on Friday. What do you think would interfere with doing a proper strep test for strep throat when they're doing the throat swab? What do you think would cause a problem?
Not
Where do
using
you
a
have
clean
to
swab.
get?
A
You
sterile
gotta
swab.
get way back on either side of the uvula. What will impact it if you get what has a ton of bacteria that you don't want?
Your tongue.
Teeth, size of the mouth, tongue. That is a hard thing. So it's just like the clean catch for urine. If they don't clean properly, you're gonna get all that bacteria from the outside area. On a throat, if you don't try to get them to get the tongue down and get back on either side of the uvula, even if you don't have tonsils, just try to go straight back, go around it. They give 2 swabs at the hospital setting because if it's negative on the strep test, they can take the other swab and do a throat culture. So it's the same thing, a clean catch urine. You want it to be only your bacteria from the bladder or the kidney. You don't want it to be from the outside skin, and then the tech goes and leaves it out for 8 hours, and that bacteria multiplies, and then they get reported that they have moderate bacteria, and it had nothing to do with a UTI or a kidney infection. So remember, if you ever get to give the instructions, it's key, because sometimes you'll have abnormal results or not good results because of the instructions. Okay, back to group 1. Tell me about the ones where you have to be collected and the patient really doesn't have an involvement. It's the technical person. Suprapubic, what's the other one, Amanda? Catheter. So tell me about a catheter. Who's involved with that? So the nursing staff would have to, or the physician. And what, do you think a catheterized specimen is good though versus if it's done properly and hopefully they clean the area very well, you're gonna know if things show up. It's really problem with the kidney and from the kidney throughout the bladder, out to the, whatever bag they collected in that's sterile. Naturally, the nurse has to do her job, or the physician, of cleaning the area before they insert it. But that should be a really good specimen. We never minded from getting catheterized specimens from ER because we knew there wasn't gonna be a lot of junk that didn't mean anything. Yes?
Okay, so you're talking about when a disposable catheter is being used, not when there's a cath bag on.
Yep, the cath bag. When they're catheterizing in their urethra.
But that urine could be sitting there for hours.
They collect it from the tube though too, like the
Yeah.
bag is down here and they'll collect it up from the
I
tube.
mean, overall, if you're gonna cath someone and give us, especially in ER, they just cath them. It's not been sitting too long at all. And then they'll give us a specimen and they'll say it was from a catheterized specimen. If it's done properly, it should be very good. I'm not saying someone, but the bag should be sterile too. But I'm not saying someone who it sat there all day and night and no one ever emptied it.
Who's authorized to use this? A catheter, even from just a bag?
Well, we always got ours from the nursing personnel, from the
Because I always
floor.
had to do it for one of my residents, and that bag is nasty. It's not, it's been sitting there for hours, it doesn't get changed but once a month, if that.
So that
So-
is a different atypical situation. In a hospital setting, especially we got most of ours from the ER, it was really good. They had just catheterized them and got the specimen. That is a different scenario, being in a long-term facility, for a nursing care facility. But overall, that's not easy
The
to,
tests in the lab, we're not gonna know whether it came from a long-term facility or straight from ER.
yeah, I mean, we do, it says ER.
Well, yeah,
And
if they're from a long-term facility and they have that cath bag from living in it.
Then the physician will have to be aware of how it's handled at that facility. You know, but most of ours, we appreciated getting one from the ER, because we knew they didn't have any of the excess stuff on the skin or everything if the nurse handled it properly inserting that.
If that's set off any flags though, because my resident came in from dehydration, we got urine from the bag. Would that something we need to set off in the, what are those, panic alert?
It could.
Wouldn't that go?
I mean, what
would that
happened
bypass
when
that?
they were, what happened in hematology? This is something that we always had happen in hematology. You tell me, what would happen if someone comes in dehydrated to the hospital from a nursing care home facility? What would their H&H be? And then what would they do, which then tell me what happens to the H&H after they do that.
It's really
When they
hard.
first come in, what happens to their H&H if they're dehydrated? Very high. It's not, they don't have any fluids, so it's gonna be concentrated cells. So we had, remember the LIS, I talked a little bit about the Delta check that I said I loved as a tech. So if we had a 2-gram drop, we had to call the floor and see what happened. And the cases when we had too high, like a lady come in, a 90-year-old lady with a 14-gram hemoglobin, and the next day she's down to 12. We had a policy, any 2-gram change you had to check, and usually they came in dehydrated, so their urine would be very concentrated, and if they had anything, a problem with anything, it was gonna be elevated if it was first morning or from a bag that had been on a long time. And then their H&H would be high the first day, and then once they got them IV fluids, it would go back down, sometimes 2 to 4 gram drop. But you had to verify that, and you had to put in that you called to verify the patient got IV fluids. So see how things kind of correlate between different departments. So what's the other one? Suprapubic. Lorian, tell me about that one.
It's kind of like a catheter that goes straight through the abdomen and into the bladder.
Okay, and I don't know if I ever, honestly, in my whole career, did a urine that was from a suprapubic that I knew. They say, I mean, I don't,
Paraplegics.
so that would be an example. Newborns, I just don't think, they have this, anybody know, group 2, what would you do for a child commonly? Do you know what they use to collect urine for a child?
They have the little bags.
We called them U bags. But that's when you can get by with maybe even down to 1 ml of urine, because that's all you may get. And it came in this little bag, and what we would do is cut off the end and let it drip into a tube, and then you might have this much in there, and then you gotta tilt your tube to get the dipstick all covered. That commonly we'll see. I don't know commonly if you'll be exposed to a suprapubic, but those catheterized and suprapubic have to be supervised. Someone else is collecting it. You're really not part of the process. Yes?
Why do some urine cups have needles?
Oh, Barbara's just showing us. The iris, I think it pulls it off into a tube, and then the tube can go to a machine. A lot of you are gonna get exposed to an automated analyzer. Most of them are using a thing called an iris. So when I go get urine specimens from Micro I like to go to Micro at St. E's, because then I figure they've had an infection or thought they were, so we'll see some stuff under the microscope. And many times they'll have the little tubes pulled off that they had gotten from the iris. And I mean, I'll look for the actual original cup, But sometimes they have a neat process where you can take off the tube and put it in a tube automatically.
Like a vacuum, like what's
Mhm.
against the
So I think you're getting exposed to that depending on if they have an automated analyzer that you'll use. Not like we have automated analyzers, but these are, they can do everything on the urine.
We do it because you can't transport through the chute, the screw top lid, so it's just
Oh,
a tube.
now
and
is that,
way-
now, you mean when you put it to a different, they
No, when
take
we-
it from the floor to you?
Yeah, what's that,
That, we had a little elevator.
yeah, we have, at the bank,
Yeah.
yeah.
They called ours the dumbwaiter.
Yeah.
Or what do you call it?
We called it a tube system.
Yeah, the tube
So,
system.
Yes,
I
the
mean-
tube
Yeah,
system.
the tube system. But you can't
Now,
put anything screw
I
top
don't
in it,
know
so-
if everybody's gone to that everywhere though.
No.
It was so frustrating because you'd get urines down, we had a policy, some department had to check this dumbwaiter every half hour because you had to make sure things didn't sit too long. And we always had screw top lids. ER was the worst though, that we had them all spilled out into the bag, hardly anything left into the cup.
Mhm.
So I think that's great. I don't think everybody's probably
No.
widespread using the tube to transport. It would be,
But it makes it easier because we have to spin them, for micro, you have to spin them down. So you have to pour it from the cup into a tube that looks like that anyway, to spin it down in the centrifuge, so it
they have,
saves steps.
before you culture micro, they spin them down?
You get to
You
do
have,
tubes.
there's a culture tube, and there's the regular tubes that have no, additive to them. So we do 2 of the regular tubes and then 1 culture tube that has something to keep the bacteria stable.
But you guys spin that tube down?
Not the.
Not the micro one?
Micro one, but
Oh,
the
okay.
ones for microscopic.
Oh,
Yeah,
microscopic,
yeah.
okay. I thought you meant for micro, and I thought,
No.
I wouldn't think they'd want it spun down. So that, I think they've come up with more efficient ways so that test results are more accurate. Okay, so, so group 2, what is the most common type of specimen container for a random urine?
Just like a plastic clean.
Just to clean. What is the most common specimen container for a culture? Can it
Is
be
it-
just clean?
No, it has,
Sterile.
yeah, sterile,
Okay, and usually it's prepackaged with a bag with it.
yeah.
What do you think would be the most common for a 24-hour urine? And what would you have to be able to handle in volume?
Doesn't it come in like a big plastic thing?
A lot of times they'll give you like, almost looks like an orange milk jug.
Yeah.
And how do you think, if you're gonna do testing on a 24-hour, how do you test the entire urine? They give 1,200 mils, 5,000 mils. What do you think they have to do before you test it? Oh, it's group 2. Just think about it, common sense wise. If I had 2 big orange jugs and I have to do a 24-hour total protein on that whole collection, do I just take a little from each jug and test it? What do you think, common sense wise, you have to do? Because 1,200 to 1,500 mils are normal, but you're gonna get some people that give you 5,000 mils, and it's not just one little jug.
But you would want like an average of them,
So
right?
would you do
So-
24?
Well, you do a 24-hour collection, they bring it in, and they end up having 3 jugs they bring you.
Would you do?
You have to like combine them?
Combine them. We
Okay.
had an actual bucket that we had to keep clean, that we would pour them all in, and then we take one little aliquot into a container. But what do you think you have to do to make sure the calculation is right before you discard all of it before?
Make sure your dilution or whatever the,
Well, you gotta measure the volume and you
Right.
better write it down. And that was a very common mistake to happen. Someone who did it didn't write the volume on the slip, and the next day someone's doing the result, and they go to calculate it, and they don't have the 24-hour volume, and if the patient maybe did 10 of, the tech did 10 of them that day, they may not remember the volume of Mr. Jones's. These are very critical things. So on the tech end, if it's over the volume of that jug and you have more than one, you gotta mix them well, then do an aliquot and write the total volume down. We're gonna do a 24-hour example when we do math for a creatinine clearance. Barb will do it with you and I'll do it with you. And it's, you have to know the 24-hour volume, or however many hours you collected it in mils per minute, and you gotta know the height and weight of the patient. So those were all critical things the tech had to make sure they had noted, because you may not be the tech who gets the urine in and tests it, okay? So that's just a little extra. So what would be the most common specimen container for a little pediatric, like a baby?
The U-bag.
Okay, so usually they're gonna put some kind, it wouldn't be common to do the suprapubic.
Oh, no.
Maybe they would catheterize if they just can't get the baby to go in the little bag and collect it. But overall, a U-bag is gonna be common. Okay, tell me, group 3, what are key things needed on the label? Yep, any label really, but what would you think?
Patient name, date collected, time collected, initials of whoever collected.
If there's a preservative in it.
Key things for sure, you better have the full patient name, hopefully their date of birth, at least those 2 things for sure. Sometimes your hospital will have a number assigned, a session number they call it. Maybe they'll have a hospital number. Those, if you need to say what type of collection. Was it random, clean catch, was it midstream, if at all possible, that really is helpful. Was it a catheterized urine? If it was suprapubic, it's nice information that could go on their report, the collection type. But at least, and what we'd have problems with the ER, they'd send us the papers in the outside part of the specimen bag, and then the patient wouldn't have a label. And they'd say, no, we swear it's that patient. And we would say, no, we don't know if that's the right patient's urine with those papers. And the only way we would allow to do it, if the supervisor, and we'd say, we'd let the person come label it, and then say, per supervisor, whoever was your supervisor that shift, we went ahead and ran it as that patient. It's your right. If it's not labeled where you know it's gonna for sure be that patient, you can reject it. It's going out on your name, okay? So at least you want the papers that come from the computer to match what's on the label, okay? So group 4, tell me what would be key things in transporting if you're not going, if you're not going to do it right at your place, but you gotta get it somewhere, what do you think would be key things if you had to transport it? And then what should you do with the urine to make sure the testing is gonna be accurate?
Refrigerate it, depending on how long it's gonna be before you can get it. to
And
the
how
lab.
long can you refrigerate it up to?
24 hours.
And then when should you test it and it be at room temp?
Once it's at room temp, then you can test it. You have to get it back to it.
Oh, when you get it, but if, what is the length of time that it has to be refrigerated if you haven't done it yet? Up to what time?
1 to 2 hours.
Okay, and I would use 1 hour as a time frame. Remember we talked about the batching and let it sit and sit and sit and sit. Think of that's your urine. You want to test it properly. If you're gonna batch them, put them in the refrigerator till you got the number you want to do. Okay, group 1, tell me, what would be reasons you would reject? Well, yeah, if you don't have any patient information, not labeled properly or not labeled at all, what else?
Correct volume.
And on a routine UA, as long as they got about a mil, but right, if there's anything, you can hardly get any few drops, just have to have the patient back or them try again. Anything else, Maureen?
And proper container and proper collection.
Right, if it's not a sterile container and it's a CNS, a culture and sensitivity, if it's one that wasn't clean at least, I'm sorry, what? If, how many of you had brought a urine ever to a doctor's appointment and never refrigerated it before?
I did that once.
I mean, do any of your doctor's offices ever tell you if you have to bring a urine, or do you collect it right then and there? Some places just have you, give you a cup and say, go now. That's perfectly fine, because not every situation can you get first morning. You can always do midstream. But I think there's a lot of doctor's offices that they'll still do it even if you didn't refrigerate it, you just brought it in with you, whatever time your appointment was. So, if you know it wasn't handled properly, you can reject it. Okay, we're gonna go around all groups, starting with group 2, and you're gonna tell me what happens when it sits too long at room temp. So each of you 3 give me one. Jen?
Bacteria will increase.
Bacteria multiplies.
Degradation of proteins and stuff.
Would you say deterioration? Or
Yeah.
what?
Yeah, deterioration, degradation, whatever.
Any cells will break down,
Mhm.
okay? Third one,
Piggyback on Jen's, if bacteria increases, so is pH.
pH increases, as it processes, it gives off like ammonia and it increases the pH. So, so the biggest clue with pH, if I know I got a fresh urine and the pH is over 7, and 8 is really the only valid one. pH of 9, they say something was wrong in the container or something. But of true pH of 8 on a fresh urine, they're gonna think a UTI, that there's bacteria in there. Okay, group 3, Krista, can you give me anything else that happens?
Bilirubin would decrease if it was exposed to light.
Okay, so it's converted to a thing called urobilin when we get to that lecture. If you at least put it in the refrigerator, you know it's gonna maintain dark. Sometimes if they know there's gonna be exposure to light, they'll wrap it in tinfoil or something to block it. Okay, you know another one, Tashawn? Not so much if it sits at too long at room temp. We didn't get that far yesterday. How many of you, did you take a look at your urine after you put it in the tube? Did any of you have more turbid where you couldn't see through it?
Yeah, I did.
Sometimes things precipitate out that you have just as normal solids in there. When you put it in the refrigerator, it's been room temp, refrigerated, back to room temp, and they precipitate out. So and some of them will be crystals that we'll see. There's some really neat crystals we look at under the microscope. So that is true. Sometimes substances that are normal precipitate out. Okay, Chris, do you have any more? There's something about a substance called ketones.
They are lost /
They kind of
They
evaporate. And that we'll get to when we get to the lecture on the dipstick. Ketones, they're volatile. They just go out in the atmosphere if you don't do that urine quickly. So if you're an uncontrolled diabetic, you're gonna have glucose in your urine and you can have ketones in your urine. Okay, so that is a key question, because that's why you want to do your urine in less than an hour or put it in the refrigerator. All the bad stuff pretty well goes away except bacteria. And then why do you want it multiplied when it maybe wasn't that high of a level? And they go treating you for something that really was because you let it multiply by sitting it too long. Okay, so now moving on to PowerPoint 2. So let me put, so as your group, then you'll come in and fill in the diagram. Remember, I have the keys you're going to study for. But when it comes to the question of diagramming, your group has to come up and put whatever you have to label, okay? So there's going to be 4 labeling. We're going to do the major kidney structures. We're going to do the the side cross view, then we're gonna do just the nephron, then we're gonna do just the renal blood supply. So the last diagram, there'll be two different groups of people diagramming it, okay? And you're gonna have to diagram all of these on the test as well, so there's no surprises, okay? So let me get those questions. And then I'll correct that one on the collection one before I put it up.
I just spaced out. I missed all
So,
that.
It's recording.
and then I got a little file box. I'm gonna put all the questions in the file box as we review, and that way when we do our final review for the final, I'll just pull them from here. Okay, so whose group did we leave off officially? When we started, what happens as the urine sits too long? Was it you guys we started with, I thought too?
yeah.
Okay, 3. You guys, one of you tell me the 4 major structures, and one of you tell me the function of each structure, and one of you label the 4 structures. So you 3 decide who wants to do what. So you're gonna label them. So you come up and label them, and then who wants to tell me the function, and who wants to tell me the 4 structures? How about you tell me the 4 structures? Name them.
Kidneys,
Kidneys.
feed into a ureter, which goes into a urinary bladder, bladder then stores it, and then goes out the urethra.
Okay. Then you tell me what the kidneys do.
They clear the waste products from the bloodstream,
Okay.
and then the ureters carry urine from kidneys to the bladder.
Yeah, you can.
Okay.
I don't know how
And then
to.
the bladder stores the urine, and then the urethra.
To the outside. So the biggest job is the kidney. Who can tell me of group 3, what is the main unit that is the working unit of the kidney? Millions of them.
The nephron.
Okay, the nephron. Okay. Group number 4. You want to come up and label, you're gonna do 2 different things. You're gonna label the cross view of the kidney, and you're gonna label the nephron on the second page. So you guys can come up, all 3 of you. And the second page, so you guys have the nephron and you guys have the cross view. Now remember, on the cross view, I could have put a lot more stuff, and I'll have the key what you study from, so everybody will be studying the same thing. Because sometimes people put a couple different things, what I'm trying to point
I put
at.
Vesa, I
I
don't
think
know.
You'll
that's right,
all be
actually.
studying
Yeah.
the same
Because
thing.
that's veins.
Yeah. Yep.
And you don't have to say minor or major, you can just say Calyx.
Her too. Oh, I would
Okay.
But you'll have my key, okay? So you know you'll always have my key to study, so everybody's studying the same thing for the test. And you
Yeah.
guys, I'm not trying to put anybody on the spot. I just sometimes think when we interact more, we sometimes, and then you can add things, because some of you are at a place working that does a certain thing that fits. So, I think that's good. So please, I'm not trying to put anybody on the spot or make anybody look bad. I'm just trying to create a more interactive learning. And sometimes people learn better that way. Like I told you, 2 of my weaker students on test, they were really good in labs. They told me when we reviewed that was their favorite way of learning. And they were 2 of the weaker ones on the theory test. So, yeah. This is like the
So I don't know what she was
middle of
looking
the
for.
nephron. This is like the outside of the nephron.
We're not sure, but, she has hers opposite of mine, so we're not sure which.
Yeah.
These pictures are really, like, not easy to.
Well, I have another diagrams I'll show you too. So just put what you think. I'll put, and then I got another set of diagrams, and you can tell me which ones you guys like better. Because I'll give you a choice of which you'd rather study for the test. Because I found another good set I had in my big binder. And only the nephron on the second page, not the blood supply.
Yeah, it's like, I guess we don't have to do anything.
I don't want any blood supply labeled yet.
Yeah. This one doesn't count, that one doesn't count.
I was trying to match these up extra.
And then I'll put my line a little bit better on that sheet, and maybe that'll help you on. So before you guys leave, I'll show you something else on the one you were questioning about. It was a good clue about the first one, the middle versus the outside. You guys already have the cortex as the outside, so think of what's more the inner.
Yeah, I guess that's right.
But I got 2 sets of diagrams, and you guys can choose. We'll let there be a vote which ones you want to study for the test. So I can put either set on.
Right.
So are you back to the cross for a minute? Or are you still on that? Okay. Then I'll point out and see if that helps. So kind of any one of these areas would be this F. Bottom of hip. Here, 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 or here, before each one. Kind of like the holder of it. This goes to, what is kind of the opposite of the cortex on the cross view? That's not pointing to any set structure. There's no real good place for me. I mean, different structures in both books. So what is opposite of the cortex? So this
Medulla?
goes to all of these, and this goes the opposite of the cortex. What's more the middle of the nephron versus the outside area of the nephron? Okay.
The medulla?
I'm thinking, like, as I look at all the different
Yeah.
ones.
Yeah, so don't worry, I'll put up,
Yeah, I thought that's what that was pointing at, was the middle.
It's actually a pillow.
No, that's a
No.
pyramid.
that's the pyramids.
The pillow.
Ah.
No,
It's not a pillow?
no, all I had, we'll give you both sets. Remember I said I didn't have everything
The
on
shells there.
across view covered. I only had certain ones, and
What, the same thing?
so let's go through the first one. So who wants to do, so is everybody okay on, we'll put them up individually. Okay, so everybody has this one diagram properly? Kidney, ureters, bladder, urethra? Okay, so we're okay there. What did some of you put that would be different?
Renal column for calyx.
Yeah, renal sinus.
Because this is what I have, and this is what I wanted. Because I didn't have everything. The cortex is the outer area. I was just trying to find something that I can point to that wasn't a structure, the medulla. Let me see if I can show one of the books with the calyx. I think of them as kind of holds.
Where the fingers are.
Okay, so the calyx is what I was hoping for these structures. Here, 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 here. So I was supposed to, I could have pointed to a better one. The medulla was just more the inside, yes.
Can you take a look at the one that you have in PowerPoint, for part one?
Let me
Slide 5.
find it. And then I'll show you, then the renal pelvis, where it leads into the ureter. And then this was just the same as the ureter. So, what'd you guys put for did no one put the pyramids?
I think the one in the PowerPoint might be labeled, wrong.
Yeah,
There might be like a
either your
mistake on it.
PowerPoint's wrong or-
Well, let me show you the different, I have plenty of structures to show you, and we can decide. Why don't we do this too? Let me show you my other one I found and see if you like this one better. This is another set of diagrams I have. See if you like this one better. And then I'll get some pictures up of the different ones.
So the pyramid is the bigger spot, and then the calyx is like where it pinches.
Yeah. So we'll show some pictures from the different sources.
The calyx like,
Does someone have an extra set?
The-
Check yours, because I had made 12.
is it where the dark part
Look
pinches?
at
Oh,
your-
well, mine is
I
even
just
worse than
gave
yours.
you.
Look, the
Just
copy.
see if there's two more.
It's
ones
like
they
this
put
area
together.
is the calyx, apparently.
Oh, I thought it was like the white
This
area
is
in
an extra
between.
one. Here you go.
No, that's the
Did you guys,
Or-
did you got that
yes.
one? Here.
Sorry.
Okay, let's just put some pictures up from our different sources and you will have,
Yeah, it's
let
the
me
white
give you
area.
the key, and then we can decide which one is easier for you. And then we'll like copy both, and then we'll go from there. So that way you'll have a set that we can agree on. Okay, so look, we'll do some comparison, and then we'll just come to an agreement of what you would prefer to study,
Oh, wait.
okay?
I thought
Oh,
you said
I
we
think
were
we do
supposed to
need
be doing
a second.
something.
Okay, so let me
We're
get
supposed
some
to
out
bring the
of,
urn today.
That's right.
I think I have my PowerPoint that I printed in my book. Then I'll show you, I got Strassenger here and, I have Strassenger here and I have Graph. So we'll look at okay. Let me. Yeah, we'll probably have to do a picture. And let me see if I can get it to focus. I don't know if it will focus better. So, the pyramid, usually most of the diagrams seem to be highlighting to the top in the book. And then the calyx, I always think of them as like little cup holders of each one of these areas. And so let's just look at some of the books and we'll see if we can come to some agreement. Okay? And so is everybody at least in agreement except everything but the medulla and the calyx? Or are you struggling with the pyramids too? Okay, so let's see.
I think it looks, yeah, the calyx is the white part, but in this picture it's the dark part. Because if you look at the,
So the renal pelvis
It's white
leads
here.
into the ureter.
that's why it looks different.
See, the calyces to me look like the little holder on each of these.
The
Let me
calyx
back up.
is pointing to the white part. In the picture,
Oh,
it's in
the
the
colors
dark.
are in
Yeah.
red.
Hey,
So to me, it looks like each one of these things are the calyces. See how it's pointing to these? And then this one doesn't even, this view doesn't even show the pyramids. But this view, you see the pyramids look like they're the tops? Okay? All I was trying to do with the medulla is to show that it's more the inside versus the cortex is the outside. To me, it's not each of these individual pieces, it's this whole inner area. So I was trying to get the pyramids here, the calyces is like, to me, the little cup holders, And I was just trying to point to somewhere on the middle, not the outside, for the medulla. So,
Okay, but those are pointing to the inside of the pyramid for the medulla. Your
but
picture,
not every picture in all these books does that. We're gonna keep looking, I'll show you. Because I have both books here.
because the way that yours, like the way this looks, it looks like it's more those little projections that are the columns.
You know, one of your pictures of like the medulla and the pyramid are the same thing, as if the pyramid sits
Right,
in the medulla.
And I'm just, and it isn't. So let's see if we can. See. Renal pelvis, the cortex on the outside. This one's not even showing, they're showing the papilla, but they're not pointing to the pyramids. The cortex on the outside, renal pelvis coming out leading. So what would you come to an agreement on? Because there's a variety depending on which one you look at. I think the calyces look like that and the pyramids are the top part.
The whole thing is the medulla, the whole inside, and the individual ones are the pyramids.
But what do you want me to point to on the diagram for you to call it the medulla?
If you were gonna ask a question, would you ask medulla, would be that whole thing, and then like a line right?
You're
medulla,
saying
and then
this
a
whole
pyramid?
thing, the medulla.
Yeah, like-
I think
just-
that's what it is anyway.
Because I want you to just label the diagram.
Okay, so like what my confusion here, so on your diagram here, these sections here, these little
To me,
projections,
the
these
calyces,
little projections that are going in, right here, are the birds in the columns. That's what's confusing us, because the medulla is the inside of the pyramid.
so you're
So the
saying
whole
it
thing
helped,
is
so
the
how,
pyramid.
what would we point to
For the med-
This
Because like-
picture
for the
is
medulla?
showing better that you know, the medulla is showing.
But
So-
the medulla is the inside of the pyramid.
No,
No.
it's the whole,
No.
it's all of
The
them.
inside, it's as you work into the kidney, the cortex is the outside. It's not just the pyramids.
Oh,
You're
Yeah.
you're saying it's only the pyramids and the medulla.
And it's
So I mean,
not.
medulla, I don't know. Is it everything inside?
Patricia,
I'm
I
still
think the
confused.
medulla is all of them together.
All
and
of this on the inside.
separations are what are the pyramids. Like the medulla is like all of this.
All of this. The cortex is all
So
of
all
the
of the pyramids
outside.
are the medulla.
Including the
But the medulla
pelvis.
isn't only pyramids.
Right.
My understanding, it's the cross view, so the intersection would be
Yeah.
the medulla, the outer section would be the cortex.
Does that include the pelvis?
What?
Can you just not ask us about the medulla?
Well,
if
you
we know
wanna just,
everything else.
do you feel okay at least about the calyces and the pyramid?
Yeah, that's,
Okay, so why don't we just take off pointing to something in the medulla? But it's this whole area, it's not just only pyramids.
Mhm.
That's what I'm hearing you say. That
I'm
the
just
medulla and the
confused on-
pyramids are the only thing.
Cause like
It's-
every
Would this be
picture, like
matching, or
when,
you-
every picture is
You
pointing.
gotta, you gotta
to
label the
inside.
diagram. That's all you gotta do is label it.
See that center section where it looks like a U, a big U in the middle, and nothing else is pointing to that? Maybe if you wanted medulla, maybe if you
Well,
pointed
I'm
this to
okay if
the
we
middle.
leave off the medulla, but it's not just the pyramids. And to me, you're telling me the
That's just what
pyramids are
picture's
the
like, that's what
medulla.
it seems to me, cause every picture you show, is just pointing to the pyramids, like, if it's the pyramids is all together, that's fine. But what you pointed to on yours
I was
is the
trying to
columns.
point to
That's
an,
why I'm
I
confused.
wasn't
These are-
pointing to a set structure. I was trying to point to something in the inside. Yes, Tiana?
So you could, like, you can label the medulla off and you can ask like what is the
Have a
inside?
bracket at the end of the line or something.
Or is there another structure you want me to put instead of the medulla? Is there something else? I mean, are you at least okay with the pyramids, the calyces, the renal pelvis, the cortex, and the ureter? Okay, so we'll just stay put with that. My point is, Patricia, The medulla
I get
is
it,
not
it's the whole
just the
thing, it's the
pyramid.
whole inside. but
I
it's
was just trying to somehow show you it's the inside, not the outside, is the cortex, and the inner part is the medulla. I was just trying to look for a place to point to that wasn't a set structure. I was just trying to point to something in the inside. I wasn't pointing to a set structure, I just didn't know where really good to point. Because the cortex, you're just pointing to the outside that's on nothing. That's what I was trying to point to on the medulla. So don't get mad.
I'm not mad, I'm just trying to understand.
Right, and that's why it's good to have the discussion. I'm not perfect, you guys, and I'm willing to make it where you all understand it. Yes?
If we use this one when it's going to we could just do a loop around it and around
Well,
this entire area.
look at the other set I gave you.
Page 3.
It was the whole, I gave you a whole set.
That question is never.
They separated the nephron from the blood supply on that second set. So I don't care if this is easier for you with it all on one page, or do you like the second set? I'm gonna let you guys choose, but you have to be majority. What?
Page 2. If this was not there, the cortex, that whole line is gone, that wasn't even there, it was gone. I would have honestly called that cortex.
Yeah.
Because it's so close to
And
the
I
outside.
didn't make the diagram. These are something I got from a book. So we can take off medulla even on this set. I'm okay if we still take off medulla. Yay or nay? Are you okay with the pyramid and the renal pelvis and the ureters and at least the calyx? Okay, we'll just take off the medulla for sure. Yes?
So I have a question, on this one right here that you're showing up, could you label where it says medulla as pyramid then?
Right. I would have preferred this to say pyramids than medulla.
Okay.
But what I'm saying, do you see how even all the books are a little different of where they're pointing to? Because I have Strassinger, I have Graf, and these were from a different book. Yes.
In your PowerPoint, you say medulla and you have like the little bracket. If you extend the bracket, just for like future use, like if you extend the bracket
On which one now?
on your PowerPoint, slide
PowerPoint?
5. Because I think that's where they were getting confused because it has the little bracket on just the pyramid. If you extend it all the way through the medulla,
So which page? This from
Page
this diagram
1.
right here?
Yeah.
slide 5.
Yeah, I just copied that. I didn't do that. I mean,
Well,
I
yeah,
just copied
but
it
I'm
from-
saying like if you want like these, you drew in they drew in some of the lines. You can like just extend the bracket.
Because I still think that is confusing.
Right,
When they
it
point
is.
to medulla.
Yeah, it
'Cause
looks
it's
like
not
a-
just one little structure.
Yeah. So I'm
So,
saying you
I mean,
can.
this is all 50 million different ways we see it. This was probably a Google image I got. So I'm okay with whatever, if we're okay to just leave the medulla off, but do you at least realize it's not one little pyramid, or it's not just the pyramids? At least if you realize that. Is that good?
Yes.
Okay, so we'll leave the medulla off. Okay, so what group were we doing that? So group, you were 4. Group 1, you want to do the one with, you guys had already did the nephron part, right? You guys do the blood supply, and then we'll have at least what I'm going to expect from the next one. You guys add the blood supply. And group 2, while they're adding the blood supply, you come up and write the blood supply in order. Because that's what I'm going to take from the third PowerPoint, the blood supply in order. So what does it start with? That's the only thing on the study guide we're going to do from study guide 3. So that one I'm going to put up completely. You won't have to do it as homework, but we'll only have part of it on test 1. So you guys come and put 7 things in order.
Okay.
7.
And so if someone
Oh,
has,
yeah, I got it. Okay.
yes.
What's this one?
This one just has the blood supply around. This is The PCT, I just wrote them. We'll put that up.
So this is nephron and this is nephron switchboard.
Right.
Okay.
Hey Jean,
They broke it apart, yes.
is this the one that we're gonna do like on the exam?
No, I think I'm gonna do my first one for the blood supply and the structures, then we have it all at one. And then I think I'm gonna use the new ones for the cross view and the 4 structures.
This is all in one.
So I'll see, when we're done, we'll see what everybody feels, if they like that better. So the one with just the nephron you would not have. If you choose these for the test, it would be this structure. You wouldn't have this one on the test. So I feel that one I like better.
Yeah, I like.
But we'll vote. And everybody gets an opportunity to vote, and the majority wins. 'Cause that's fair.
I have
Yes.
ask a question about that, because this is what kind of threw me off when I was doing it, is it's kind of, because I look at pictures online, so it's easier to see,
Okay.
I haven't got the book yet. You know, they have veins and arteries colored and stuff, and it feels like it's just kind of all jumbled together. What's the best way to like tell that apart though? Like,
Well, when we go
from the
through,
efferent, I guess it's.
afferent goes from the renal artery into the glomerulus. Efferent leaves the glomerulus to go to the peritubular capillaries.
Okay, then can I ask you one more question? On this picture, which way is the entrance and which one's the exit?
So this is the renal artery going into the glomerulus.
Sometimes they're viewed.
Okay, thank you.
Okay? But we'll take a vote.
Like a lot of,
It'll be the bigger one, like think of
The
like
bigger
an
one?
artery,
Okay,
like,
gotcha.
A and A.
yeah, to
The
me,
afferent's on your
to
artery.
me it's just easier,
I like.
I did this all
So we'll come to an agreement which ones you're gonna study for the test.
Yeah,
Because
the
we have
afferent
a
is always
piece
like
for
an
both,
artery.
and we already agree, we'll just take off the
It's
medulla.
just gonna be this.
Okay? That's common consensus. Okay, so this is the order you have to write on an essay question. No matching. And it has to be in order to get all the answers correct. Okay? That's the only piece we're going into the 3rd study guide. I will have the whole 3rd study guide key up, even though you won't have to do it for homework, even though we're only doing a piece of it. And this ties into that document, labeling it. That's why I wanted to go that far, because you had to label it. Yes?
So you said you just want those, you don't want it like what each step does?
Nope.
Okay,
You have to give them to me in order,
right, so
and
just
then they
that.
have to also be labeled properly. Okay? So, let's look at these and then we'll vote. So this is, set 1 is the original ones in the study, the syllabus. Set 2 is the new ones I handed you. Which set do you want for the 4 kidney structures? How many people want the first original set? This is for this piece.
That's just fine.
This is the first set. So how many you want for the cross? We'll do it together. The 4 original structures, we'll do the 4 original structures, and then we'll do the cross view, and then we'll worry about filtration. What process occurs in the renal tubules? 2 of them. And secretion. Those are the general. That'll move on to PowerPoint 3 before we get into that. So does everybody realize then, so this was the glomerulus, B, A was the Bowman's capsule, and then the proximal was letter, you guys see, I think that's letter F. And then the distal was letter G, the collecting duct was letter H, and the loop of Henle was letter E. So did all of you at least get the nephron part correct? Okay? This is the renal artery going into the glomerulus. So the renal artery was K. Then the afferent arteriole, the afferent, or however you want to say it, goes into the glomerulus. That was letter C. Then the efferent leaves the glomerulus, and that was letter J. Then the paratubular capillaries, they surround the proximal, so PP. So that is the part that surrounds the proximal. Then the part that surrounds the loop of Henle is called the vasa recta, and then it ends going out the renal vein. So you gotta know them and write them in order, and then you gotta do your diagram. What are some other names for the proximal? You would have, what else could you see? PCT, sometime on the one diagram I gave you, I labeled it just as PCT. Another diagram, I did DCT, so proximal convoluted tubule, you might hear or read. DCT, distal convoluted tubule, okay? So you know this part, that list, and then the blood structures, even though that's part of PowerPoint 3, are on test 1, okay? Yes,
Sorry, so the 1 through 7, that is like the order,
you gotta have them in order,
that's the order of,
the blood supply.
order of blood.
Into the kidney. Okay, so now let's get out, the last thing we'll do is kind of go over some lab for tomorrow and what will be on your test too. So let me hand back what I have, and we'll just spend a few minutes on this, and then you kind of, we'll review next week, but you'll kind of have a little review to kind of know what to start studying. So, tomorrow you will want to have Lab 1 worksheet. We're going to complete and turn in right away after we go through them, okay? And then I have Lab 1 week 2 I put up on Blackboard as well, and I corrected the syllabus, so it's the correct syllabus up there, it's not serology. Okay, so group 1, you tell me what was one set of urine QC we did yesterday. Okay, tell me about the K. What do you remember about the K?
I want to say they had a little bit of everything.
Well, one was,
That was the weird one, because level 1 was what? Normal or abnormals? Abnormals, all of them. And then level 3, and these were Roman numerals, were all normal. Tell me the second set of QC we did, group 2.
And 1 and 3.
Yeah.
Sorry.
I don't care.
And 1 and 3.
Okay, and tell me about the abnormals on those. All on one or what?
No, they were different ones.
Can you remember? I didn't see, we haven't gone through results till tomorrow. Do you remember which ones had what? Because we're gonna go through your results tomorrow before we start. So how many controls do you have to do before, when you're setting up the urines to test in the morning? Can you just do one of them? You gotta do 2 levels minimum. How many QC did you do in hematology? Do you remember? Did you get to run QC when you were doing the maintenance on the machine?
Yeah, there's 3.
You did 3, right? Because some of your patients will be low, some will be normal, some will be high. Okay? Group 3, tell me what were 3 things you did as part of the physical exam of a urine. You give me one, you give me one, you give me one.
You looked and noted the color.
Color? And what's a normal color?
Light yellow.
Yellow. Okay, that's normal. What's the second thing we did on the physical part? Think about it.
Gravity something?
Specific gravity, measured the dissolved solids, and then there's one more. When you looked, we had colors, clarity. Another term they call is transparency. Group 4, what was the second piece of a urinalysis you did? Okay, the dipstick. So you each give me 2 chemicals on the dipstick that go together for something. So Tiana, think about 2 that go together on the pads. We kind of went through that in general on the board.
Are you asking versions as well?
No, I'm not gonna make you memorize times, just some, do you remember how many were at 60 seconds? 5. Tell me 2 chemical analytes that you did yesterday that go together for a disease state. So nucleosides. Leukocytes, nitrates go with what? UTI. Tricia, you tell me 2 that might go with something.
Well, the one pH can also go with the UTI.
pH, and what does it go up to?
8.
8. So alkaline, above 7. Okay, so that's good. Can you think of any other 2 that go together for a disease state if they're both present?
Glucose and ketones.
Glucose and ketones go with
Diabetes.
mellitus, right? And then tell me what would go with kidney function, because sometimes you might not have a second one that goes. No. What would go with kidney disease that would show up on your dipstick? Just general kidney disease. It's one of the analytes.
Protein?
Nope. Protein. Any level of protein, 2+ or greater, or 300 or 100 or greater, goes with general kidney disease. Tell me, can you give me an idea what bilirubin and urobilinogen might go for? Because I don't know if we really went into that one, those two too much. They kind of go hand in hand for maybe a dark yellow, amber looking urine. Might also be a clue. It'd be liver disease. So we're gonna, that was one type of yellow you want to worry about. If it starts getting to, on a fresh urine that's dark yellow or amber, you're sometimes thinking hepatitis. And then blood. Give me an example of a blood you could see from your hematology course versus a blood you might see from trauma or maybe a UTI. That's pretty severe. Anemia, so hemolytic anemias, what would you see from that pad? Remember the pad tested for something unique with blood? So intact red cells or like hemoglobin. So your hemolytic anemias would be positive for the blood on the hemoglobin, but maybe trauma to a kidney or a UTI. What else am I missing on there? Oh, who wants to explain it, you guys, on the nitrite? Negative or positive? Why? And it can still be a UTI for either. Anybody remember? Who converts nitrates in your diet to nitrite?
Isn't that chloride?
Yes, which is a gram negative. And then why could you have a gram positive, like I told you, enterococcus, and it would be negative on the nitrite because what gram positive, can they convert nitrates to nitrite? They can't. So when we get into micro, you're going to have to know characteristics that are common of the E. coli, which is a group of bacteria. Abnormal. What is the most, you guys, back to you, what would be an abnormal clarity or transparency? Do you remember what I said is probably your most common abnormal clarity on a fresh urine? Cloudy. Okay? The colors can vary on any kind of UTI. Okay, so tomorrow we will start with reviewing the results you turned in, then we'll staple that all together, go through that, and turn it in. Then what we're going to do, you're going to bring in a urine of somebody, whether it's yourself again or a family member, and then you're going to do 2 levels of a control. We'll probably do the MAS ones, and then you're going to do 4 of your urines. Try to pick someone you didn't do the other day, and we probably didn't get to many, but whoever you're sitting by. Then I'm going to teach you how to do confirmatory tests. So we're hoping we're pretty efficient with the urines, and then we'll add to the confirmatory test. Okay, so that'll be the third piece. You're learning the physical, the chemical, then we'll confirm, and then next week we'll probably start getting microscopes out and look at them on the fourth piece, okay? I'm sorry, what? Wednesday at 8, okay? Because this week it was just, and well, I told Dana to give me the schedule of her people, and when she does, we're gonna just make sure we're in the lab when she's in here. So, because we kind of got a wacko 8 weeks. But the students say it works, so I don't want to stop it. Otherwise, we got to go back to straight, all 3 different classes. And it's hard enough doing 2.
Yeah. Like
So,
definitely. You already have plus 3 days a week doing it this
So
way.
we'll
So you would have like what,
periodically,
4?
PowerPoints, we'll do them like
No, we
this.
would have
Otherwise,
still 3,
PowerPoints
but
we'll
1
do
from
in
each
class,
class.
and you'll just do
Because
the
we double up
same
on
class.
chemistry right now, but we would have
Yeah.
1 from each class.
So like 3 different principals.
And you said
Yeah.